Okay, so good afternoon, everyone, and welcome to the first webinar with this PhysioMaster Association about facial reflex therapy for pain management. My name is Muhammad Awartani from Jordan. I'm the first Arabic in the world who is teaching this concept. I'm working under the International Institute of Reflex Therapy in Barcelona, the largest school in the whole world, and the most popular and the most efficient therapy in dealing with different cases, especially neurological cases and autoimmune disease and many kind of diseases. This approach or this concept or this amazing therapy is used for especially for medical and paramedical field like physiotherapists, like occupational therapists, medical doctors, and all complementary medicine. It is, as we can see, we would like to mention that you can say according to the country you are living in. Some countries are calling it alternative medicine, and others call it complementary. So I prefer to call it complementary medicine. Okay, so the idea of this lecture is to introduce this therapy in the right way, so that people and as you as a therapist can learn something unique that you can help your patients and give them a nice and safe treatment through face. First of all, I will try to share for you something about this therapy. I hope that everything is okay because this is my first time to share things on Facebook. We usually do it on Zoom and other webinars. Okay, so okay, so first of all, I would like to talk about the International Institute of Reflex Therapy, Loin Sorensen. The owner of this institute is for the Danish amazing therapist for more than 42 years. Her name is Lone Sorensen. Lone Sorensen, she is basically a reflexologist, and she developed her own approach to treat different kind of diseases and improve quality of life. And she is the one who established different methods. We call it, especially this one, facial reflex therapy. Um, it is we call it also medical reflexology, if we can say in this way, because we deal with different kind of diseases. Okay, so this therapy is basically today we're talking about is to help you and to teach you how to treat and ease pain from different parts of the body like head, neck, shoulders, lower back, sciatica. If you have any different issues in this way, how you can treat it through face. And this is amazing. And this is, we consider it as a part of our diploma. We teach it in whether online or offline. So the idea of this concept is to work and to find out different what you call a deposit, which is under skin. I'll try to demonstrate for you in a few seconds because I think it's better to show you something on the uh, uh, PowerPoint or something. Let me see what can I do for that. Okay, okay. So let's go back again. If we would like to give a definition for facial reflex therapy, facial reflex therapy is called a manual stimulation for by applying manual stimulation to face or different small places on face here and everywhere to try to improve quality of life, to improve health issue for any kind of patient, let's say for children, for adults, for any kind of disease. Okay, by using only hands. We are usually using index, only index to apply this manual stimulation. And this is not called like a massage. No, it is a regular stimulation under skin. Dr. Hirschman Danares, he's a medical doctor who developed this concept also, and he found out under skin that there is a deposit, what we call it under skin in the dermis, called deposit. We can found that there is something wrong under the skin. As we know that usually the Chinese medicine, they found out through feet that they can have a map for organs like stomach, spleen, colon, liver, etc. And he also found through feet also how to treat the brain issue. In our concept today, we are talking about facial and how to treat health issues like brain dysfunction and brain damage. So, in this way, the idea is to combine both Chinese medicine with Tibetan and Tibetan and Vietnamese issue, Vietnamese concepts in this way under skin. We have what we call microsystems. This microsystems, it's a small specific areas that we use it under skin in the specific areas in the body. For example, if I'm looking for treating a stomach problem, I can treat it through face because I have under skin, I have a place to treat it by manual stimulation, regular manual stimulation. In this way, as a physiological effect, I'm sending an order to the brain through this nerve ending to the brain, telling him that there's an issue, there's a problem in this organ, on this part of the body. And once he receive and once he in the process this issue, he is sending back hundreds of impulses to the affected area to treat itself, to recharge itself, or to cleanse itself, so that it will help the patient to release his problem. The concept, what we are talking about, is basically that uh, the, uh, the idea is vital organs are the most important parts in the body, which manage everything, like the brain, like muscles, like nervous system and hormonal system. So when we are looking for an issue, let's say for physiotherapists, for instance, if we have here a muscular pain, like in the cervical spine or the like shoulders and deltoids, etc., here we are looking for something, what we call it, what is the cause of this pain, what is the problem of this pain. So what we have to do is, first of all, is to stimulate the vital organs: stomach, spleen, colon, liver, heart, small intestine, etc., as Chinese medicine, through face, of course, to find out what makes this problem, why this problem is happening here. So when we found out, and we work under skin like this and like this, we are looking for dent. We are looking for deposit under skin. It's like a blockage under skin, which help not to work well, you know. So in this way, it will interfere the patient to be better and better. In this way, we are trying to help him. We are trying to help him in this way to find out the cause of the problem by stimulating the this organ. Okay, so put in your mind that when we are treating this patient, we are looking for, first of all, to find out the largest deposit, the main cause. For example, I'll give you an example so that we can know what's going on here. For example, many of patients suffering from neck spasm, neck pain, okay, and he trying massage, he trying to take medication, he's trying to do even physiotherapy, hot packs, etc., but nothing work. He's still in pain. In our concept, here, we are telling them that there's an issue in your stomach because muscles in the neck, it is attached directly to stomach meridian. So I have to treat the stomach first of all before I go to treat the muscle itself. And here we can help, whether we work on face or hands or feet. But today I'm teaching you how to treat through face because it's such an interesting thing, and it's unique for you and to help your patients. Okay, so this way this is the way we think. For example, many people or many patients, as you know, have a problem in his rhomboid muscle. Okay, rhomboid muscles in our concept is attached with gallbladder and liver meridians. So if I want to treat this muscle completely, I have first of all to treat the gallbladder and liver meridians, because I will find how to treat it through face, and then and then I'll go to the part of the rhomboid muscle. For us, I will show you how to treat the muscular issues first of all here in the easy way. Okay, um, let's hold on, please, so that I can find for you something to treat. Okay, okay. I'll try to share something here for you. Uh, hold on. Okay, okay. We'll get back again because I'm not being able to share, but it's okay. Uh, we'll go back here again. Okay, so please, I would like to teach you now, basically to an idea to teach you an easy thing. So what you have to do now is to have a cream or an oil and apply it on your hands and rub it on your face, because we are going to apply this small technique now to help you. For example, if anyone has a cervical and scalp pain, okay, let's try it again. The idea is to work here. This area, it's presenting my scalp and the beginning of the neck. So what we have to do is to using our both index in this way and put hands like this, okay, like this, and start rubbing, press and pull, small strokes, press and pull, small strokes. You have to find out where's the painful area. If you find out the painful area, in case you have a pain in your cervical or your scalp, you can just keep pressing until you found out that it will become softer. If you found out that it's become softer, then at the same time you press here for 2 minutes. You press here for 2 minutes, and you'll find out that your pain here has gone immediately. So you have within working 5 minutes here in the specific area. Again, the idea is I'm trying to use my index, both index, to find out the most painful area, for my scalp and the beginning of cervical. Okay, here what's going on here? When I'm working here, I'm sending an order to the brain telling him that this body has a spasm in his scalp. So this way he will receive the order that I'm sending him to the brain, and at the same time he is going on to send impulses to this area to release. The body will release pain inhibitors and endorphins. And this way your pain will go. Okay, this is the first one. Let's say I have a problem in the cervical spine and the muscles around the cervical spine and the spasm. To let you know, we have a nice thing that this cervical, our spine, how to find out if I have a problem in my spine, just look at your nose bone and cartilage. In this area, what we have here is it's representing our spine. Okay, so here this area is our cervical spine, and here is our thoracic spine, and on the cartilage we have lumbar and sacrum and coccyx. Okay, so I want to treat a patient who is suffering from cervical issue. Let's say he has a bulge disc. Let's say he can't move his neck, and you do your physiotherapy, and he's still in pain. So in this way, I would like to help him. I can finish this session by applying facial reflex therapy or a part of it through here. So what I'm going to do is I'm using my thumb in this way. I put like this, and I'm starting rubbing down slowly. And it's better if I'm using like this, press and pull, like this, press and pull. And he will feel he's in pain in this area. He will find out a pain area. Now you find out the most painful area, and especially if you find something under your skin clicking. In this way, you still just keep working and working and working for 2 or 3 minutes. Then what you have to do is to press on the painful area for 2 minutes. In this way, he will find something. He will still in pain in his nose, but at the same time in the cervical area, he will his pain will release, will gone at the same time. If he has an issue in his cervical and pain radiating on his shoulder and hand, here under the eyebrow, it's presenting our hands. Here is our shoulders, right and left shoulder. And here's the hand. He is in the middle, our elbow, and at the end here is our wrist joint and hands and fingers. Okay, so what we have to do here is to use like our cream or oils, and to rub it like this and start working. Let's say if I have a pain radiating in the left side, I'll start press and pull small strokes like this, and you'll find out that it's too painful. After working on the cervical spine, I'll start working on this way, rubbing slowly under the eyebrow, exactly on the bone. And once you rub like this, you'll find out that there's something wrong. There's a click under the skin, and it's too painful. But you still work and work and work and work. And here in this way, it is an elbow. It is an elbow here. You still work, and here's the hand, and the end in this angle. In this angle, this is our wrist joint. For if you have like carpal tunnel syndrome, you can treat, okay, at least you can release pain. Okay, you can release pain here by using this one. Apply more and more, and then press and hold if you have. Okay, so you have many examples here you can treat. Let's continue. Now, if you have like the problem in the thoracic spine, here's the thoracic spine, and here's the lumbar spine, and here's sacrum. Here in both sides, we have here two hip joints. Here exactly, here and here. Okay, in right and left. So if you have sciatica, if you have a patient who has suffered from sciatica and he can't move, after you have done your session of physiotherapy, you can use your facial reflex therapy in this way. I'm start from here and go down slowly. Never do it like this. No, you can do it slowly, like this, in this way, and go down and down and down and down. Here, it's the lumbar spine and sacrum. I'm still working and working and working and working like this. Okay, and then if let's say the patient has a problem, the sciatica radiating in the right side of right leg. Okay, here is the right side. So I'm gonna use two index again here. I'll press and pull like this, and it will be too painful for the patient, but it's okay. You press and go like this, in this way. Okay, go down and down and down, again and again, until you reach here in this area. This our knee joint nerve ending. Okay, and this way I work, still working on it like this. I press and pull. It's like this, guys. Press and pull in this way. It's like you use your hand to work on sand. Okay, it's the same thing. When I'm working like this, in this way, here I find out a click, so I keep pressing. Then I change my hand to go to the tibia and the calves, and go down and down and down like this. When I'm reaching here, when I'm reaching here, I think there's a problem here. Okay. Okay. I think there's a problem here, guys, in my video. I don't know what's going on. But I'll check out again, go out, and come back. Okay?